My name is Anna Parker, and my presentation is on fetal alcohol syndrome, a disorder including intellectual disability and characteristic facial anomalies that affects children exposed to too much alcohol during fetal development. When taken in moderation, alcohol can be harmless or even beneficial to the health of adults. For example, consumption of 1 drink or so is associated with reduced risk of cardiovascular and Alzheimer's disease and with improved control of blood sugar levels. The psychoactive effect of alcohol in the nervous system is biphasic in that there is an initial stimulant phase that is then followed by a more prolonged depressant phase. Chronic use of alcohol can cause damages to nerve cells of the superior frontal cortex, Purkinje cells of the cerebellum, and hippocampal pyramidal cells. Severe alcoholism is also associated with thiamine deficiency, which can lead to neurodegeneration and Korsakoff syndrome, a neurological disorder associated with memory loss and confabulation. Alcohol abuse by expectant mothers can cause permanent brain damage to the developing fetus. About 40% of children born to alcoholic mothers demonstrate anatomical, physiological, and behavioral impairments known as fetal alcohol syndrome. Most anatomical impairments are incorporated in deformities of the face, such as a sunken nasal bridge and an altered shape of the nose and eyelids. In some cases, the children are born without a corpus callosum, the main band of axon that connects the left and right hemispheres of the brain. The most common problem associated with fetal alcohol syndrome is intellectual disability. Most impairments involve language and fine motor skills. FAS children may also exhibit other abnormalities such as irritability, tremors, and hyperactivity. Although many mothers of FAS children are heavy drinkers, many of them do not have children with FAS. These mothers may also have one child with FAS and one that does not. Serious malformations produced by FAS are not found in infants born to mothers that are moderate drinkers. A study by Henriksen and colleagues in 2004 demonstrated that alcohol consumption during the week in which they conceived led to an increased rate in pregnancy loss. It is estimated that in the overall population, between 0.2 and 1.5 of every 1,000 babies is born with FAS. If every alcohol-related birth defect was accounted for, the rate would become 80 to 20 such births for every 1,000 babies born. A study conducted by Morris and colleagues in 2008 revealed that although both non-Latino white women and African American women lower their alcohol intake while pregnant, the non-Latino white women lower their alcohol intake more than the African American women. Kaiskin and Moore in 2005 demonstrated that the US and Canada have the highest involvement and recognition of FAS, whereas the UK and Australia have the lowest. Oswald and colleagues examined how social communication activities in the classroom differed between children with fetal alcohol syndrome and their normal peers. Performance was recorded based on 6 behavioral dimensions that consisted of prosocial engaged, passive disengaged, irrelevant, hostile coercive, assertive, and adult seeking. The study demonstrated that FAS children have more occurrences of passive disengaged and irrelevant behavior than their normal peers. Lyles and Pacman proposed that child-centered play therapy could help children with FAS as it has helped children with ADHD, behavior problems, social skills problems, and cognitive impairments. Some of the objectives for child-centered play therapy are to become more self-reliable and self-accepting, to develop a trust for oneself, as well as to learn how to conduct a self-determined decision-making. Because a specific safe level of alcohol intake has not been identified, it is best to avoid alcohol consumption altogether to prevent fetal alcohol syndrome. If you have an alcohol problem and are planning a pregnancy, seek professional help prior to conceiving to develop a treatment plan. I hope you have enjoyed my presentation on fetal alcohol syndrome. At this point, I will answer any questions that you may have.